When we think of HIV and AIDS, we think of a death sentence. However, today, it's a chronic illness. Prevention is the most important part of that conversation. So joining me today is a specialist of infectious diseases that's going to share with us how to stay safe. Come on. Joining me right now is Dr. David Hardy. His specialty is infectious diseases. Dr. Hardy, thank you for being here.
My pleasure, Greg.
How long have you been a specialist of HIV?
I started doing this in 1982. AIDS was first described here in Los Angeles in 1981. I saw my first patient in 82.
Because back then it was known as the gay plague, geared specifically to the gay population.
Correct. And I think the important point that would be important to get out today would be that anyone is potentially at risk for HIV infection if they have sex or if they use drugs. Not necessarily even always intravenous drugs, but just drugs that may be mind-altering. Because it may not be the drugs themselves that transmit the infection, such as intravenous drugs, but it could be the way it makes people behave after they are under the influence of the drugs, have perhaps unsafe sex. So that's something
most people don't even think about that, doctor. So from 1981-82 to where we are today, how has HIV/AIDS changed?
Tremendously. I mean, overall, having been a physician now for a little over 30 years, I can tell you that this is probably one of the biggest and most interesting and I think successful stories in modern medicine. That we've taken a disease that was pretty much 100% fatal when it was first discovered, and for the next 15 years after that, to making it a disease that most people who have it rarely, if ever, die from it ever anymore.
So it's not a death sentence anymore, it's more of a chronic illness.
Exactly. HIV is eminently preventable. And I think the really important thing here is that we know very clearly how this infection is spread. We know very clearly how we can stop its spread by being safe in terms of sexual encounters.
So let's talk safe and how not to spread this disease.
It is spread primarily by two body fluids, blood and sexual secretions. And this is something that by avoiding direct body-to-body contact with those, HIV is not spread by other sorts of means.
Doctor, do you see a cure coming at all?
Definitely. You know, 5 or 6 years ago, when you asked that question, I would have to say maybe. But having been doing this sort of work for almost 30 years now and being involved in laboratory research as well as clinical research, we have the technology available today to cure HIV infection. It's just a matter of being able to put those things together, probably in combinations of things like gene therapy and stem cell technology, to be able to find a way to protect one's immune system from infection, or if someone's already infected, to be able to give them protection that will outlive the virus. And I think will actually happen within our lifetimes.
I love that. What are your final thoughts to anybody in regards to HIV?
I think it's really very simple, Greg. You know, the important thing here is to stay negative, to really be careful about becoming infected. We know how to keep people negative. Very soon we may very well have a medication licensed in the United States, which will be given to persons to keep them negative. And the other important thing, I think, is to encourage people to get tested. HIV testing is very, very important to identify the infection if it is there, get treated, because not only will the treatment help the person who is actually taking it, but it will also markedly decrease the chances that person may transmit the infection to anyone else, which is a very important thing to do as well. If your doctor, if your healthcare provider doesn't offer an HIV test, ask for one. Just like you would ask to get your blood pressure checked, get your sugar checked, get your cholesterol checked. Ask for HIV test as well.
Doctor, it was an absolute pleasure. No matter what disease it is, have a conversation about it. The most important thing you have is your health. So talk about it. Thank you, Doctor. Thank you. Welcome back to HEALTHline. Tonight we're having the conversation of HIV and AIDS. And years ago, when somebody heard the word AIDS or HIV, it was considered a death sentence. Now, through time, money, and research, it is known as a chronic illness. So many people in the industry have suited up and showed up, especially people in the entertainment industry, from Elizabeth Taylor to Elton John to Farrah Fawcett when Amphar first started, and as I already mentioned, Magic Johnson. Everyone is here to stomp out this deadly disease. Joining me is Zachary Ginder from the Alegria House here in Los Angeles, and their mission is to take care of families in need. Zachary, how is HIV/AIDS spread?
Well, HIV is spread in only a few ways. One, through exposure to infected blood.
Okay.
Through semen or pre-ejaculate.
Okay.
Vaginal fluids. using a dirty needle that has been exposed to HIV,
Okay.
and through mother to child, whether that's through the birthing process or through breast milk.
Do you feel that, especially with where we are now, people pay attention to this? Or do you feel that it's been pushed to the side a little bit and feel, like I said earlier, oh, it's not going to happen to me?
I think that there's definitely a misconception that this isn't going to happen to me, that this is only relegated to a certain group or population,
type.
right? But really, this affects everyone. And going even one step further is taking those universal precautions to protect yourself.
What are the precautions?
It can be anything. Universal precautions means assuming that everyone is infected, therefore you always take the necessary steps to protect yourself. Whether it's gloving up when you encounter someone who's bleeding, to using prophylactics, to any other type of thing that protects your body from potential infection.
What do you say to the young teenager that is so in love with so-and-so and that this is the right moment and they're afraid?
I would say have that conversation. And I would also say don't take their word for it.
Do you still support prophylactics in youth centers and all over for people just to know that it's right there?
I do. I support all types of universal precautions, whether it's dental dam or making sure to use gloves whenever you're being exposed to bodily fluids, to condoms. Effective condom use can greatly reduce the risk of transmission.
When we come back, Zachary's going to share with us all that he does at the Alegria House, and we're going to visit Bobby, who lives with HIV. Do not go away.
I'm Zachary Ginder from the Salvation Army Alegria, here to give you a health tip. Always practice universal precautions, which means protecting yourself from infected blood. That can be through using rubber gloves, through using condoms, or anything that can protect your body from infected blood. Get tested frequently, especially if you're sexually active. Also, have a conversation with your partner. Discuss these things openly. It may be a difficult conversation, but it's one that needs to be had. To learn more about HIV and AIDS, go to www.aids.org.
How do we recognize perfection? How do we attain it? For over a century, we've provided the best health care in Glendale by striving for perfection. And now we've made the biggest upgrade in our history. The latest technology, the best physicians, brought together in our new state-of-the-art digital campus. All in our quest for the only perfection that matters, you. Glendale Adventist Medical Center. Healthcare at a higher level.